So today's training topic is the reality of malnutrition in older adults. I am very proud to present to you, our presenter on this topic. I don't want to gush too much about Mr. Blancato, but I met him 10 years ago when I was a graduate student, and I chased him down at a conference when I was just tapping into my own passion around elder justice. And Bob and I have had a wonderful relationship over the last 10 years. And when he started being more involved in this important topic of malnutrition and also what the link is to elder abuse and elder rights, I definitely thought, gosh, if we could get him here to Colorado, it would be wonderful. So I'm very happy to have him. Bob Blancato, he is the president of Matz, Blancato and Associates, located in Washington, D.C. He's the national coordinator of the bipartisan Elder Justice Coalition. He also serves as the executive director of the National Association of Nutrition and Aging Services Programs. Bob has more than 20 years of service in the Congressional and Executive branches, including the senior staff of the U.S. House Select Committee on Aging and an appointment by President Clinton to be the executive director of the 1995 White House Conference on Aging. Bob's volunteer leadership includes serving as the chair of the board for the American Society on Aging and on the National Board of AARP. He also serves on the board of the National Council on Aging. In September of 2015, Bob was appointed to the advisory panel on outreach and education of the Centers for Medicaid and Medicare Services. Bob has also served as volunteer state president of AARP Virginia and as the president of the National Committee for the Prevention of Elder Abuse. Bob is a contributing blogger to the Huffington Post and Next Avenue, writing on aging issues. He holds a Bachelor's of Arts from Georgetown University and an MPA from American University. Bob has won numerous awards for advocacy. In 2011, he was knighted by the Italian Republic. We are so happy to have Bob here with us today. Thank you, Bob, and I'll turn it over to you.
Thank you very much, Sherry.
You're welcome.
Good morning. Good morning. You know, if I heard another part of my introduction, I would have thought it was my living obituary. But thank you, Sherry, for the invitation, the opportunity to be here. It doesn't take a lot to convince people from D.C. to spend a little time in Colorado. It's a beautiful state, always, a special place to be. Let me echo the Happy Valentine's Day for those of you who plan to celebrate. I do plan to be back in Washington tonight, or I might be a dead man, and I look forward to that. I want to thank Molly as well for her contribution to making this thing all come together well. I chose this invitation in part because we could blend two areas of focus that I have right now. For those of you who know the work of the Elder Justice Coalition, which has been around, and I noticed that this esteemed group is celebrating its 25th anniversary, and our Elder Justice Coalition is celebrating its 15th anniversary this year. And we have been involved, as many of you know, in the activities in Washington to try to promote elder justice by preventing elder abuse. And when malnutrition sort of came to the forefront, we discovered by things we've been looking at that there is a linkage. And so during the course of the presentation, a couple things. First of all, this will blend both topics. Second of all, as Sherry said, questions are welcome at any point because, my dad was an anesthesiologist. You know what they do for a living, right? Put people to sleep. My goal was to never emulate him at a podium, you see. So like a long stretch of talking, can do that. So I encourage folks to take advantage of it. So let's get started, and let's start with the very basics. In everything in life, when you're taking on a cause, it's about starting with a definition. And when we began our work with this Malnutrition Coalition about 2 years ago, and it came about in part because many of you know, and maybe some of you are involved in efforts to combat hunger and food insecurity among older adults. And that's a serious issue. But malnutrition is a more serious issue that has gotten less attention over the course of time. So part of what we do in our public awareness activities is to list out for people to understand better, what malnutrition is. And again, obviously having the presence of at least 2 of these following 6 clinical characteristics. And, the part that sometimes when you're educating an audience for the first time, the line that always seemed to work was that you tell people that you can be obese and malnourished at the same time. And then all of a sudden, people begin to understand that there's a focus about what it is that you consume, the nutrient issue. And so malnutrition can be those 2 conditions of the 6. It's often associated with general physical wasting. It's linked to chronic disease. And, they can be any sort of weight, underweight, overweight, normal weight, or whatever. And so we try to start our presentations with a discussion, and then we move to the focus of why older adult malnutrition. And these numbers are very significant as you go forward. 1 out of 2 older adults being at risk. And there is, by the way, a handout. Did you guys get your multicolored handout in the back? Okay. When we get to the topic of the blueprint, that sort of is the short version of the blueprint so people can see the major findings that are in there. But again, you have this risk factor involving older adults. In Washington, it is all about healthcare costs. It is about how do we address the rising healthcare costs in this country. So every time an issue comes up, people first look at, is it contributing in some way to rising healthcare costs? And in this case, a 300% increase in healthcare costs with those with poor nutritional status. They spend 4 to 6 days longer in a hospital. The estimate now is we're approaching $51.3 billion in costs for disease-associated malnutrition in older adults annually. And 60% of older adults in hospitals may be malnourished either at the time they come in or at the time they leave. And so these are numbers that are beginning to have people in Washington take notice as we address issues around nutrition and its linkage to health. So a little bit about the Defeat Malnutrition Today Coalition, which is the entity that is working in this space and has produced the blueprint. The first thing I always tell people is the story on how we ended up with defeatmalnutrition.today. And this is a generational story, I guess. When we were looking for a name that was somewhat catchy to start a new coalition, I said, let's have something like Defeat Malnutrition Today or something like that. So my associate, who Sherry knows, considerably younger person than me, says, do you know that there is an ability to say defeat malnutrition .today? And I said, I thought it was just like .com and .org and whatever it is, but apparently she discovered that there is a .today, making our title really easy. And we're very pleased that we were able to do that, and that's how we got our name. And the second part of that, the name part is the relationship to healthy aging and how defeating malnutrition is vital to it. And maybe by the time today's over, we'll pick up a few more members. But we started with, sort of what we call the usual suspects. The Academy of Nutrition and Dietetics, the groups that parental and enteral nutrition groups, the National Associations of Nutrition and Aging Service Program, Meals on Wheels America, groups like that. And, we put out a generalized announcement that we were creating a coalition, and I remember the day that 2 came in that came really out of nowhere. One was the Salvation Army, and the other was the National Parks and Recreation Association. And they joined us in the very beginning and have contributed to our work. And as time has gone on, we've been finding health systems are becoming interested in joining the coalition. Just this week, the National Medical Association, a minority-based group in D.C., joined. And just yesterday, the Medicaid Managed Care Plans of America joined the coalition, which is very important to us. As you know, the whole landscape around aging services is changing with managed care. So we are a coalition of national, state, local groups, but it goes beyond nutrition. It has healthcare professionals, faith-based, and private sector groups. So that's one of the questions that I should have started with when I began. How many people in this room are from the healthcare sector? Raise your hand. And how many of you from like adult protective services or anything related to elder abuse prevention? Okay. How many people are involved in social or human services, like aging networks? Okay. Any law enforcement people here? Okay. Any faith-based people here? All right. Anybody I missed? Any category I missed? So we got everybody covered. Okay. So in many ways, this room kind of reflects the way we have constructed this coalition, because it's a question of having many voices speaking on behalf of an issue. And then, of course, in any coalition, whether it's a group like this or a national group, you have a goal. And the goal here is to achieve the recognition of malnutrition as a key indicator and vital sign of older adult health risk, and to work to create policy change to a greater emphasis on screening. And I can't emphasize that point enough. The screening issue is really at the heart and soul of the efforts that are being made to defeat malnutrition today. We've got to introduce more opportunities for screening for people in the community, people in the hospitals, so that we can have detecting, treating, and preventing malnutrition. So that's our mission, our work going forward. We're 2 years old. We just started with a small group, and we're very happy with the growth, and our goal is to get to 100 groups by the end of the year. So what we do is we participate, as we're doing today, in events at the national level, state level, local conferences. We are working with a number of states, Massachusetts, Ohio, Virginia, and Florida. Yesterday, the state of Massachusetts passed a bill to create a malnutrition commission for older adults. And they had their first meeting yesterday of their commission, and I was very happy to speak to them by phone before I left to come here. And, you know, we see this activity going on in different states, and it complements, if you will, the work that's being done at the national level. And, but our biggest project is this national blueprint, Achieving Quality Malnutrition Care for Older Adults, which was released just about a year ago. And it's, again, you've seen a picture of this before, but this is a pretty significant undertaking. Many of you have been involved in writing reports and doing blueprints. The first thing that you basically have to do is, you know, examine some of the factors that go into the issue of malnutrition, so that you can understand where you need to put your points together. Disease-associated risk factors, function factors, social mental risk factors, and hunger and food insecurity risk factors. You know, we're not walking away from the notion that hunger and food insecurity don't belong in this conversation. They certainly do. But think about it this way. You know, part of what's in this blueprint is about creating a malnutrition care plan. Okay? There's really not a hunger care plan or a food insecurity care plan. Malnutrition requires a care plan, and one of the things we're trying to do is get to that point. So let's spend some time on this, because this really is the heart and soul of the blueprint and what we recommended. You know, with 4 basic goals. I'll read the top line, and then, you know, you can look underneath at the specifics underneath it. But obviously, first is to improve the quality of malnutrition care practices across the country. You know, obviously, the second one, identifying gaps, is at the very important part, because there are a lot of gaps, a lot of inconsistencies in how it's done. In the area of transitions of care, and some of you who raised your hand on the health side and the social service side know the story about care transition programs that were established under the Affordable Care Act, with the goal of reducing hospital readmissions. And what you do is you create programs, support programs that provide those services that keep older adults from getting readmitted to the hospital, thus saving Medicare money. But most of the earlier models in care transitions did not focus on nutrition. And we are now seeing how to come back and restructure the care transitions program in an environment when there's a concrete effort to dismantle the Affordable Care Act, as you know from what you've read, going forward. But the care transition piece actually does have some support on a bipartisan basis. But one of our goals is to say, if we're going to go this route, we have to build a stronger nutrition piece into this care transition model. Second goal is to improve access to high-quality malnutrition care and nutrition services. And, this is all about the notion of care coordination. This is all about the notion of integrating quality malnutrition care in payment and delivery models and quality incentive programs. One of the things I'm going to try to avoid doing, and if anybody catches me like using things like CMS, NIA, whatever it may be, and using the DC problem of acronyms, you call me out right away. Say, what does that stand for? Okay. So, in the Centers for Medicare and Medicaid Services, which is CMS, which is probably for our field, all the people in this room, that may be the most important federal agency that there is, especially with all the activity that's going on in Washington. And we are going to spend some time later in this presentation talking about Washington and kind of what's going on that may be of interest. But one thing they are working toward are quality measures in a range of different care settings in a Medicare program. And there are 4 malnutrition standards that are trying to get into the quality program of CMS. We worked as a coalition to the point where we have got a commitment from CMS that they will be added to the quality measures in the near future. Now, if you know anything about Washington, words like "in the near future" are kind of dangerous, because your job as an advocate is to keep them focused on what that means. When do you actually see something, okay? And we are having a good conversation with the new people at CMS, and hopefully that'll lead to quality measures being adopted in the future. And strengthening the nutrition professional workforce. I mean, there isn't an area in healthcare, particularly dealing with older adults, that we don't need to strengthen the workforce. The shortages that we have in geriatric medicine, in nursing, across the board in healthcare is atrocious at this point, and it was predicted. I go back 30 years in my working life, actually more than that, 40 years. And I work for a guy that, and looking around this audience, if maybe 2 people remember this name, I'll be shocked, but there was this legendary congressman from Florida named Claude Pepper, who was the chairman of the House Aging Committee when we used to have one in the 70s and 80s. And the 2 issues he identified in 1978 that needed to be dealt with were ending mandatory retirement, which at 65, which we had in our country back then, and addressing the looming workforce shortages for geriatric care. And 10 years ago, the Institute of Medicine came out with a very important report about retooling for an aging America, again, talking about strengthening the workforce. This has to include the professional workforce in nutrition. Third goal is to generate clinical research on malnutrition quality of care. I'm not a researcher, a lot of you may be, but I do know that not enough research has been done here. That seems to be a growing sentiment that we hear in our work on the Malnutrition Coalition. And there's 2 kinds of things about research. Doing the research is one thing, and then having it translated to something significant on a policy basis is the other. And we're hoping that in the malnutrition space, we can get better quality research to improve effectiveness and patient outcomes, and have, I guess the other part about research that's very important is that decisions that are made in Washington are driven by data. In the environment that we're in, if you have good data, you have a shot at maybe getting more support. But if you have no data, or bad data, or suspect data, it's tough to even hold on to the money that you have. And anybody who knows the field of nutrition knows that, particularly in older adult nutrition, I'm a long-time advocate, defender, supporter of the Older Americans Act nutrition programs. Some of you may know it as Meals on Wheels. It's also congregate nutrition, where the folks come and get their meals every day. The one thing that we don't focus enough on is that for every dollar you put into malnutrition quality care or the Older Americans Act nutrition program, you're making an investment of federal dollars, because those funds are saving Medicaid money and Medicare money. If an older adult is showing up every day for 15 years at a congregate site and getting their meal and getting nutrition education, or someone who's homebound is getting a meal every day and getting a friendly visit and everything else, where are they not? They're not in a hospital and they're not in a nursing home, where it costs a whole lot more to provide that service. So part of what has to get done to move that needle is to improve the data and improve the research across the board in nutrition. And then finally, in the fourth goal, to advance public health efforts to improve nutrition and quality of care. It is about training healthcare providers and administrators on malnutrition care quality and educating the older adult themselves, their caregivers, on the whole issue of malnutrition. You know, in many ways, you know, it can be a very simple conversation about what it is that you eat and how important it is that you maintain good nutrient quality. Obviously, number 3 is something we spend every day working on, educating and raising visibility with national and state policymakers. You know, the other lesson that I can share about working in Washington is that, you know, every good issue becomes a good issue when it gets a champion in the House or the Senate who can take that issue and say, this is my issue, and then go forward and move the process forward. And sometimes it's based on nothing more than personal experience. If you look at all the activity that's going on in the Alzheimer's disease space right now in Washington, it's because more and more members of Congress are confronted with Alzheimer's in their family. If you look at diabetes research, I can trace it back to those members of Congress who had that in their family as well. And now the place that is very interesting to see the champions developing is in the whole caregiver space. Because, you know, it's amazing to me that an issue that there's 43 million American families that have some caregiving responsibility of one kind or another. That's a huge number. Well, somebody, and actually, this is where I'm proud to be an AARP board member. Any AARP members in the room here? Raise your hand. Hey, there we go. You're all my friends. That's good. And don't worry, the rest of you will be. You'll get that letter. You'll get that letter, I assure you. But AARP began a process of surveying, you know, members of Congress about, you know, caregiving issues. And they discovered, as to nobody's surprise, that they too have caregiving challenges in their families. So now there's a new bipartisan Congressional Caregiving Caucus that was created about 1.5 years ago, which is the first step toward elevating those issues. But in this area, we must spend time recognizing the importance of the caregiver in a malnutrition care plan. They're critical, but they must be educated. And then, of course, you know, integrating malnutrition care goals in national, state, and local population health management strategies. And then, of course, allocate the necessary education resources to the Departments of Health and Human Services and the Department of Agriculture. And we're going to be talking about some budget issues related to them. So, I don't see anybody itching to say anything yet. Anybody ready to pop up with anything yet? Yes, please. We love the first person. The first person is the key. It all goes from there. And you remember there's an old saying that I think will be very apt today. There are no bad questions. There can be some bad answers, but there are no bad questions. So
this is a skeptic in me, and maybe it has to do with what you were saying about Congress likes to hear about saving dollars and so on.
Right.
But when you talk about Congress being responsive to Alzheimer's because they're starting to be impacted by it, or diabetes, I get a little skeptical because Congress probably, in a day-to-day basis, is not faced with issues of malnutrition at one level. But can you say a little bit more about kind of your kind of strategy in terms of helping policymakers and lawmakers realize the true impact of this?
Right. One very good example that just occurred maybe 6 months ago. There's 2 senators of great note who are active in the nutrition space, Senator Casey of Pennsylvania and Senator Patty Murray from Washington State. And, you know, we said to them, you know, one thing that we really have never done that I'm aware of is there's an investigative arm of Congress called the Government Accountability Office, or GAO. To ask GAO to examine the nutrient quality of the food provided with federal funds for older adults. Okay? And they say to me, well, you know what they're going to come back and say. You know, it's not that good, or it could be better. And that's going to mean we're going to be having to ask for more money. But then Patty Murray says, you know what? I'm ready for that fight. I'm ready to take that on. Because if we are improving the quality of food provided with federal dollars, we will be contributing to the better health of the older person. And members of Congress ask the GAO all the time to do studies or investigations, and they only approve about 15%. This one was approved. The work is underway. We should have a report out by the end of the year. And the other thing that we do, and it's easier with the Older Americans Act Nutrition Program for this reason, and Senator Bennett, by the way, is a great champion of the Older Americans Act, always has been, and Congresswoman DeGette as well. But you can take them, you invite them to your program. These programs operate in every congressional district in the country. And a little off topic from this, but I'm going to share it anyway because I think it connects to it. In one of my other associations, the group called NANASP, which is really a horrible, long name standing for the National Association of Nutrition and Aging Service Programs. We got a grant from the Retirement Research Foundation to do a study, or to at least begin a process that hasn't been done before. For those who understand the Older Americans Act Nutrition Program, it's supposed to do three things under the law: provide a meal, provide nutrition education, and provide a socialization opportunity for older adults. The last piece has never been really looked at. Yet, you know, it was put in the law for a reason. If your goal in an Older Americans Act is to promote the independence and dignity of older adults, you try to put programs together that contribute to that. So we said, okay, we'd like to look at this. Now, if you get a small grant, for those of you who are people who receive grants, you know that you shouldn't go overboard with what you think you can do. So a grant of $25,000 means you do a literature review and you send out a survey to nutrition providers asking them some questions about their participants. How long have they been coming? You know, what's the main reason they come? You know, they have more friends since they came, et cetera, et cetera. But me being someone who doesn't follow rules as carefully as I should, I discovered that since I go out a lot for different presentations, that if I went to a given community and I asked the congregate nutrition provider if I could go visit their program and actually sit down and talk to older adults themselves and ask them those questions, we might learn even more. And so far, I've had the ability to talk to over 220 individual older adults in 7 states in programs. And 95% of the answers to this question, the question is, what is the main reason you come here every day? The answer is socialization. And, you know, we're not going to publish empirical research on this, but when the Older Americans Act comes up next year for reauthorization, and we're in there fighting for more money for the nutrition program, we can present this as an example. But what I do more importantly is I invite the congressional staff person or the senator from the senator's office or the houseman to come with me to these programs so they can get an education as well. So we're doing it slowly, and it's going to take some time. But I think what we're going to find is in September, you know, there's been an observance called Malnutrition Awareness Week. It's usually around the week of the 20th of September. And a wonderful group called Aspen, whose name I can never really get right, but it's the one that does parental and enteral nutrition. People in the room would probably know the term better than me. Aspen is their national group. They sort of invented this Malnutrition Awareness Week. And over the course of time, they've done a certain number of things, you know, put out papers and whatever. But last year we joined them, and we did a webinar during Malnutrition Awareness Week, which drew over 1,100 people. We had to go to like somebody else's bigger platform because we didn't have the capacity where we were. And of that group, about 25 were congressional officers that got on because they've been hearing a little bit about this topic. So it's a long answer to your question, but we are finding the little ways to infiltrate. And that's really what it's about. It's making the personal connection. And of course, Meals on Wheels has never really had a problem in that area because, you know, they have a dedicated time period, like, you know, Mayors for Meals, and, you know, invite members to go on Meals on Wheels routes. But here we're trying to go a little deeper in malnutrition. So we also go back to the people that we know have a history in the nutrition area. So how to achieve these goals from the blueprint? Obviously, you know, things you want to do right away. And then there's some cross-cutting actions that you need to do if you're going to make this thing go together. And you have to figure out who your stakeholders are and get them engaged. National, state, and local government agencies, healthcare practitioners, institutions, medical professional societies, individuals, families, caregivers, patient advocacy groups, which is, by the way, one of the harder groups to get into this discussion. They're sort of scattered, and we're trying to make some different approaches to them. And of course, aging organizations, since we're focusing on older adults, and public and private payers. So, on the state activity, let's go back to that for a second. Let's talk about what's been done in different states. And by the way, focus on that last bullet there, because I'm hoping that we can come out of here with maybe some initiative in the state of Colorado to do something around malnutrition. In Ohio, they created a commission through legislation. They named their members, and they had their first meeting. And usually when you do something through legislation, you get the buy-in of the sponsor of the legislation, and if the governor has to sign the legislation, they get sort of involved in the process as well. If they get to choose the people on the commission, that builds another kind of relationship. And Ohio's been doing some pretty good stuff. In Massachusetts, like I said, they created their commission, had their first meeting yesterday. I was on the phone with them for about 10 minutes, and this group was charged up. They had all the right people at the table. In Virginia, and this is me being, a Virginian, okay? I may sound like a New Yorker sometimes, because I came from there originally. But my state senator and I got into a conversation, and I said, we need you to do something in Virginia to put malnutrition on the map in older adults. So in our state, maybe in a lot of states, you really don't have a chance if you're offering a bill that's going to cost more money or add any sort of new bureaucracy somewhere. So in our state of Virginia, we have a statewide Commonwealth Council on Aging. And I'm sure they have one in Colorado, a statewide commission. And I served as the chair of that commission a number of years ago. So basically what she did, she put a bill together that added to its existing charter a requirement to put together a malnutrition care action plan for the state of Virginia. Went through like that. The governor has a signing ceremony for this event. And all these people come in, and I guarantee you it raised the profile of the issue. In Florida, they are creating their own advocacy coalition in partnership with the state. And my colleague has been down talking to them and getting them set up. And I sense this can happen in a number of other states. And there's a toolkit, which we'll talk about later. Should anybody here want to take the initiative in Colorado, we have the toolkit that tells you what steps are really effective in doing something like that. And if we could, double the number of states involved, and there's another factor involved, you'd be surprised how many members of Congress follow what's going on in their state legislatures as a means of understanding what's an important issue. So if we can get that done here, then this trip will really have been worthwhile. And if you need any help, I guarantee you we're there to help. Oh, I didn't know this was coming next. There you go, see? That's what happens when you don't memorize your slides, right? And in fact, Molly knows, actually, as you'll see later in the presentation, our goal in doing presentations, particularly if you're coming from Washington, is to try to be current. And if you write slides 3 days from earlier than today, they could be obsolete by the next day, based on the rapidity of events that are going on in Washington around a variety of topics. So we had to do a whole sort of addendum yesterday that she was good enough to get on this presentation. But take a look at this, jot down, there'll be up at the end of this presentation there's a resource page of how you can find more information. But if you're interested, really take time and learn about this to do advocacy at the state level. Now, this is when we sort of begin. Yeah, I'm sorry, please.
Of the 4 states that you have up there, which one would you choose, your state, to look at as far as maybe one to look at and model?
Yeah. Well, first of all, I'd have to answer that with not necessarily knowing the political climate here. I mean, is this a very conservative state where it's hard to get, new resources committed? If it is, then take the Virginia route and, take something that currently exists, that is statewide in reach, that is either focused in healthcare or in aging, and, work with a senator or whatever your lower house is out here, and get them to, ask for a modification of their charter, and that can be done, easily. you know, if you've got, I mean, a unique style that's being tested in Texas, actually, but it's not far enough along that I could put it on my slide, is they're trying to develop a public-private partnership approach. You know, to have the authority passed through legislation, but have it be funded through the private sector, you know, following all their different rules. I mean, commissions these things don't cost a lot of money, but any new money in some states is like, you know, you don't have a prayer. So I would say if the simplest route is probably the Virginia route, the broader route would either be Ohio or Massachusetts in that situation. And if we learn more about what they're doing in Florida, you know, we'll be happy to share it. So now this is where we're going to start dabbling into a little bit about what's going on in Washington and things of that nature. You know, we decided to keep this slide even though we are now in a different environment relative to the budget process. But, you know, last year, just about this time last year, the President produced his first budget proposal. And in there, you know, he had proposals to abolish the social service block grant, the community development block grant, the community services block grant, and maybe 8 or 9 other programs, which was astounding to people that you would go and ask that these programs be eliminated. Now, for those of you who know the community development block grant, a portion of its funds are used for home-delivered meals for older adults. You know, not a giant portion, but a portion. So the next day, after the President's budget comes out, at the White House press briefing, some enterprising reporter from ABC asked the budget director for the President, why are you picking on Meals on Wheels? And there's pretty much his answer, because they don't show any results. Let me tell you something. We couldn't ask for a bigger favor as advocates, because in my role as running this NANAS group and the Meals on Wheels Association folks, I mean, our phone started to ring like within an hour. And who were calling up? Other members of Congress's office saying, where is the nearest home delivered meals program in my district or my state? Where's the congregate site? We want to go visit them. And we knew immediately from what these programs do that they would see that they do produce results. And as a result of that, we will probably be seeing over the coming years increases in funding for these nutrition programs simply because of that ill-timed comment by that former congressman, by the way, who runs the President's budget office. But now let's get current, okay? Somehow it's like those of you who watched Groundhog Day, you know, and kept repeating the same things over and over again. Well, this new budget of the President's just came out on Monday, okay, has some of the same disturbing trends as the previous budget that he came out with. Those same programs I talked about that he wanted to eliminate, he's asking again to be eliminated, social service block grant. And by the way, for our elder abuse folks, you know what SSBG is, the only federal funding source for adult protective services. You know, and the notion that you're going to get rid of that program is devastating to the elder abuse world. But look what else is also in this budget, and something we're very concerned about. How many people know about the Commodity Supplemental Food Program? Anybody familiar with that program? Okay. You know, which became an all-seniors program about a year or so ago, 2 years ago, you know, where older adults are able to get a package of, you know, of commodity food to supplement their intake of food. They want to get rid of that. I mean, that came out of the blue. I have no idea why that was proposed, but it's in the President's budget going forward. Eliminating SNAP Ed. Now, you all know the SNAP program, the old food stamp program, Supplemental Nutrition Assistance Program. You know, any federal funded nutrition program has to have an education component to it. Because you may provide somebody a meal, you know, at lunchtime 5 days a week, but there's a lot of other meals after that that they still have to eat, and they should know what it is that they should be focused on in their eating. Same thing with SNAP recipients. And to get rid of the education program seems a little short-sighted. There are proposed cuts of over 30% for SNAP over the next 10 years contained in the President's budget. And there is the new proposal, I don't know if how many of you saw this, that you take your food stamp benefit, whatever it may be, The proposal is that half of the benefit would be replaced by a new American Harvest food package. Okay? A package that would be given to SNAP recipients that has fruits and vegetables or whatever is in there, grown in America, versus the existing SNAP program where you get your benefit and you go out and shop for what you want. An idea that, again, has raised some eyebrows in Washington. But again, this is what we're contending with in the President's budget. So let's take a look at a chart, because some of these programs that we're talking about, I want to put them in context, because after this slide, I'm going to talk to you about a more positive development that's happened in Washington, which could have a huge benefit for a lot of these programs that are on this chart. So for you to see this chart, the things to focus on really are the first column, okay, is what these programs are funded at right now. And some of you are in these programs, so you know what it is. In Washington, they have a term called a continuing resolution, which means, in simple terms, it's Congress failing to do its job. When October 1st comes, the fiscal year begins at the federal level. And most every year, there's no budget ready to go. There's no funding programs for individual agencies. They have not finished their work. So what they do is they pass a continuing resolution to fund the government for a short-term period at the current levels of funding. They've now passed 5 of those continuing resolutions since the beginning of the fiscal year. Okay, the most recent one would extend funding through March 23rd. Now, for some programs, that's a good deal, because some programs that are perhaps targeted for cuts or elimination are not affected right now because they're funded at current levels. For those of you, anybody know the SHIP program? Okay. I mean, another one of these amazing stories about how do you not appreciate that program? How do you not support the program at a time when health insurance counseling is so important for so many people? Yet the President's called for elimination of SHIP. Last year the Senate did, this year the House is calling for it. But nothing can happen to SHIP as long as you have a continuing resolution, because the funding continues. So, you know, just focus on that first column if you want to get a level set about where the funding levels are. The columns that follow, right now, they were relevant on a slide about 2 weeks ago. They're not relevant anymore because some big things are about to happen in Washington about funding levels. Is your hand up, or am I just, oh, okay. No, feel free. So I'll keep that up there for a second. And then.
We don't see the slide.
You know what? Oh, where'd that go? Oh, I must have not hit the right button. Let's see. There.
Thank you.
Thank you for pointing. I'm supposed to be looking at this thing, right? I mean, hello. See, I'm looking up here on the podium with my sheets of paper in front of me. So, all right, let me start all over again. I apologize. So the column on the left is where those programs are funded at the moment through March 23rd. Okay. These other columns that come after it, you know, relate to where they thought they would be going in funding for the fiscal year that we're currently in. Okay, but that process is not finished. And so as long as that process is not finished, you have to rely on that first column to ensure that funding continues for these programs. Because, you don't hear the term government shutdown? Okay, we live in this crazy, they've had 2 already. Government shuts down when you hit that March 23rd, and then if they're not ready to pass another extension for funding, then the government shuts down. That's not going to happen. Again, they've had their fill of it at this point. But what I want to share and put in some context is kind of like where we are right now as of February 14th of 2018. I talked about the first part, okay? For those who are worried about losing their funding or having their funding interrupted, everything is fine until March 23rd. But as part of that bill to extend to March 23rd, Congress did something very unusual. First of all, they did something on a bipartisan basis, okay, which you know is the rare situation, not always the majority of things. How many people remember sequestration? and you live through it, the 5% across the board cuts that apply to many programs, and 5% was a floor. A lot of people got hit more than that, right? This 2-year budget agreement that Congress that passed as part of this says, number one, you will not see sequestration appear back at least through September 30th of 2019. But more importantly, it provides for $63 billion in increased spending in what are called non-defense programs, many of those same programs that were on the chart beforehand. So lifting the spending caps means that those programs that have the most effective story to tell and the most effective advocates or lobbyists to tell the story, and also the grassroots people can tell the story, will get new money. And they'll get new money fairly quickly, because the goal here is to have all these different spending bills agreed to on or before March 23rd. So, for example, in senior nutrition, the NANAS group and the Meals on Wheels group, we've had 4 conversations in the last 2 days. We will announce next week a specific funding increase we're asking for that we're going to be pushing as 2 associations along with some other groups. And we feel comfortable that with this wiggle room, with this new money available, those programs that have merit will do well. I mean, a perfect example. This $63 billion includes $2 billion in increased funding for the National Institutes of Health. Okay? $2 billion in additional money. Okay? There's also $9 billion in there for opioid-related activities, which, you know, our only concern is that for some reason they seem to believe older adults are not impacted by opioids, and there's a huge growing tie between opioids and elder abuse. So my point here is that you, as advocates, should take your program and begin communicating with your members of your congressional delegation about them supporting necessary increases for whatever program that you care the most about or you're most involved in. Because this is an opportunity we've not seen in 10 years. The last time we had an opportunity like this was in 2009 when President Obama in his first year passed what was called a stimulus bill. And out of that bill came some big increases for some critical programs for older adults. This same opportunity presents itself right now, but this is a time for advocacy to go to work. And then let me go back. I talked about this in response to your question, but these are the programs that Government Accountability Office will be looking at to see, you know, how far are they in meeting nutritional needs of older adults. And, you know, I know that the people who provide cargo meals try hard, but they have budget restrictions. You know, they're trying to diversify their meals to meet the clientele they have. And, you know, at home-delivered meals, the same thing. In home-delivered meals, the struggle is, do we do the frozen meals versus the regular meals? And, you know, there's a lot of things that go into this. But having a report back like this that identifies what's not right and makes some recommendations can lead to new legislation that might help our overall malnutrition cause. Because federal funds used for nutrition programs should provide healthy foods for those they serve. Yes. Thank you for breaking this up. Please. Oh.
I'm sorry.
So on the outcomes, especially for the Older Americans Act nutrition programs, one of the things we struggle with, I'm with the State Union on Aging, is what you just said, that the vast majority of people go to congregate meal sites for socialization, not for nutrition issues specifically. And when the GAO looks at this program, are they going to take into account that if somebody goes to a meal program 3 times a week, obviously their nutrition needs aren't being met, but the value of the socialization outweighs, you know, even 1 day a week. If they're getting out of their house and interacting with their community, it's a benefit.
Well, that's very true, and it's very interesting going back to my, you know, less than empirical study work that I've been doing with older adults. you got to push them to use the food, the meal as their motivation to come. They're not critical of the meal, but it isn't necessarily the main thing, except for the fact that there wouldn't be any socialization without the meal. And this is the part we're trying to explain to them. I mean, I will tell you, I mean, for those of you who've ever been through these kind of programs, and obviously you have, there's a process. It kind of reminds you like of third grade. They all sit at the same table, and there's always like a ringleader at every table. And I learned this a very funny way in Fort Wayne, Indiana, when I did my first of these conversations with older adults. And I said, why do you come here, this and that, and this and that. And there's one woman who clearly is the ringleader, right? And now this was a congregate site in a senior housing apartment. And she said, I finally said, look, I got to move to the next table, and I just feel like you have something you want to say. And the woman says, well, I do, but it took me a while. I had to make sure I trusted you first. I said, okay, we got past that. She said, the main reason that we come here? To gossip. Who cares? It's part of the deal. However, we will be able to translate those findings that come from the GAO into a more integrated approach for funding the Older Americans Act nutrition programs. Because the nutrition education component is very important, improving on the quality of food, but, again, to meet the specific interests of older adults in food, there has to be some diversification. You know this, I mean, the challenge of having a new 60-year-old come into a program and be attracted to it different than a person who's been there 15 years, 75, who's used to a certain menu, whatever. And the other part I find fascinating in this little work is when you ask around the country, what's your favorite meal? You don't get the same answer. Like in Indiana, what the favorite meal was of older adults? Liver and onions. I've never had liver and onions in my whole life. I mean, maybe some of you have, and maybe it's a great thing to have. And then you have roasted chickens, another big favorite. Okay? And then some place has a vegetarian day. But somehow they got macaroni and cheese in there, call that a vegetable. But, but all that being said, the goal here is to take this malnutrition argument right into the use of federal funds. Please, in the back. No, oh yeah, one here and one there.
Okay, I'm sorry. For me, the biggest challenge is we talk among ourselves as service providers, and we talk to our legislatures, state, federal, what have you. We do not interface or take our information to business. We need to be talking to the people who have the money. And the fact that there aren't representatives here from the Aurora Chamber, from Rotary, from the organizations that have the ears of our legislatures is one of our biggest challenges.
That is a very valid point, and I'll say something else to that very point, and it's something that we have tried to do, and we're having more success than we've had in the past relative to programs like the Older Americans Act. Underneath all the good things they do, it's also a job creator. Okay, it's an economic development force in a given community, and sometimes in the same way as you deal with like Medicaid expansion. Is this a state that expanded Medicaid? I don't know. You did, okay. Why did that work? Because it was going to bring new money into the state. The support came from the hospital and medical world, who could go to their legislature and say, look, this means this much new money in my program. But we could never do enough in that space. And we'll and you're right, it has to start locally and then move its way up to thing. And what some groups do in some states, I mean, they go into meetings with the legislature, with their Chamber of Commerce, or with their business people, to make that message clear. Just like some people go in with faith-based people on something. So it's a valid point. I hope that, it gets more attention here, and I'm sure somebody heard that comment. So we'll see. Yes?
Has there been specific research that has resulted in advocacy for malnourished seniors raising grandchildren?
Not yet. That is a category of new interest. You know, the Older Americans Act. Let me back up a second. You know, you brought a subject that's near and dear to my heart up because, you know, Sherry mentioned in 1995 I had this wonderful opportunity to direct the White House Conference on Aging for the President Clinton. And White House conferences on aging are held every 10 years. The goal is to help sort of shape national aging policy for the ensuing 10 years. 1995 was when grandparents raising grandchildren first emerged as an issue. And how did it emerge? If you want to talk about a great grassroots story, this may be a classic example of that. We're holding a forum in a town, Cupertino, California, which back in 20 years ago was not the Cupertino, California it is today, which is all Silicon Valley and this and that. And there are 4 members of Congress there, 2 from California, 2 that were on our board of the White House Conference. And the last of these forums was about grandparents raising grandchildren. And we walked into this event, and there were 5 grandparents on the stage. And you could cut the emotion and the tension with a knife when you walked in, because what they were telling was how they became in that role. What set of circumstances put them in that role? Incarceration, passing of the parents, the restraining order, whatever it may be that did it, right? But they had no rights. You know, they weren't recognized that way. Now, at least, you're starting to see some federal programs that give grandparents, you know, the rights that they should have as the primary caregivers. And I used to be on a board of a group called Generations United, which sort of shepherded the area. But this very question about that component of research was talked about, and one of our partners in the research space, Avalier, which is a big health consulting firm in town, has asked to be able to look at that topic. So I could see something coming down the space, because I forget the most recent number I saw. I think it's like 4.3 million grandparents are primarily raising their grandkids. And that number is skyrocketing. And, you know, so we'll take a look at that and see if we can find it. And I would also point out the same Older Americans Act that we've been talking about before has a National Family Caregiver Support Program in it, of which a 10% set aside is to deal with grandparents raising grandchildren. And hopefully that's going to grow as time goes on. So I'll be happy to share through Sherry when we find out where that research is. Anybody else? It's all on this side. What's the matter over here? Nobody. We'll come to you later. We're going to talk about elder abuse in a second. So this farm bill issue that's up here, you know, it may not jump out at you as something that why would we care about a farm bill? You know, we're not farmers, or we're not. You know. Well, because the farm bill houses some very significant programs, like the SNAP program, the Commodity Supplemental Food Program, the Senior Farmer. Anybody involved in the Senior Farmers Market Program out here? Anybody know about that program? Yeah, right. One of the greatest programs ever created. You know, you talk about, you know, sometimes things, the simpler they are, sometimes they can be the best you can be. Here's a program that provides low-income seniors with a higher degree of access to fresh fruits and vegetables in their communities through these Senior Farmers Market. So what do they get to do? There's 2 benefits in this program. One is to the low-income older adult who gets access. And second is a small farmer who has a whole new market to sell their products to. So the Farm Bill provides the authority for these 4 programs to operate. It has to be renewed this year, as bills have to be renewed periodically. And there's going to be a pitch battle over how much is going to be available. The SNAP program continues to be under assault for people who think it's too big, people think it's growing too fast, and people forget that it's a safety net program for people who are in need. So there's going to be a pitch battle about this going on, but we are prepared to fight that battle. And to that point, let me just go through this slide with what it is we're talking about with the SNAP battle. Is your hand up? No, okay. Look at this. You know, look at these cuts in this program. You know, and you know anybody. You know SNAP here. You know the people who participate in the SNAP program. And actually, the worst part, from a standpoint of older adults, you know, just about 4 years ago, only 1 in 3 older adults who were eligible for SNAP were getting SNAP. 1 in 3. Now it's up to 42% through a lot of outreach and benefits outreach programs that are being done, funded by the Administration on Community Living, National Council on Aging, and so on. But, you know, this is critical. I mean, benefits outreach can't be a more important topic. If you are an individual eligible for a program, particularly if it's a program based on being in difficult economic straits, you know, the last thing you do is not be aware of the program and participate in the program. Yes?
I don't think it's necessarily because it's not aware. I mean, I work with seniors and that's
Wait,
I'm sorry.
we're gonna bring the mic up. Thank you.
I want to make sure everybody can catch it.
I work with seniors here in Denver, and the majority of my residents live on Social Security between $577 some dollars and roughly $1,400. So most of mine qualify for Medicaid, and I don't know if it's necessarily that they don't know about SNAP. Most of my residents that fall within that range, they get about $16.23 a month. And unfortunately, because of the way Denver Human Services is overworked and don't have enough staff, a lot of my residents opt out of the program because their yearly paperwork we have to submit 4 or 5 times, and they don't think it's worth the hassle of $16 a month for, you know, their yearly recertification and having to send in every single year their Social Security income, their rent statements, and all that paperwork for it to then get lost and having to have it resent. And I think that's a good piece that we really need to look into all states, is that how is our bureaucracy and our government systems really affecting the nutrition of our seniors? Because $16 a month, I mean, in all honesty, is not a lot, but that is $16 you can put towards either, you know, high protein meats or fresh fruits and vegetables that you normally can't afford. A lot of my residents now are trying to look at organic options to better serve their nutritional needs, and those are products that they can't afford without those services. But this holdup in bureaucracy is really a struggle for me on a daily basis, and I'm sure it is for other people, that these systems are preventing people to get this access that they really need and deserve.
Yeah, I have heard the same stories in a lot of other places in the country, and it is something that needs to be addressed. I think the challenge is if the emphasis in Washington is about, you know, avoiding duplication and or doing consolidation and stuff. I mean, one of the places you could start is to look at programs that if you become eligible here, you lose your eligibility here, yet it's still serving a very low-income group of people. You know, so I think there seems to be more of that happening, because I know on the low, I mean, the minimum benefit was raised in the last Farm Bill, because it was even, I think it was $10 back 4 or 5 years ago. And so advocates worked effectively to at least get that spoken to, but then at the same time, because that rise in benefit, then eligibility in other programs became questionable. I know that the Senate Special Committee on Aging is looking at that very topic as a, you know, to put it on the spotlight, to say, you know, and get some real life people to come in and talk about. And it's going to get heightened now because of things like proposed cuts or eliminations of programs like commodity supplemental food program. So my suggestion to you is, you know, you need to communicate the real life things you're confronting with each and every one of your congressional delegation, because, you know, you probably should spend some time looking at, and some of you do this and some of you could do this more, you know, look and see what committee Senator Gardner's on, what committee is Senator Bennett on, okay, how relevant is it to your work? You know, are they sitting on a committee that has jurisdiction over a program that you care about? Same way with your House members. And then, you know, you need to build a relationship with their offices where you, I mean, the most effective advocate is an on-the-ground person. The most effective advocate is the one who can tell the story based on the real-life experience that they deal with every day. The most effective advocate recognizes they're speaking for somebody else who may not have the ability to speak, like that person who, you know, walks away from the $16 or doesn't want to go through the effort, or whatever it may be. So I can't encourage that enough, but I'm glad you raised it. It's a real live issue, and it's one that you're not alone in. The question is, how do you sort of mobilize in a way that puts us to the forefront as we start looking at changes to different programs? And I'm taking the notes on your comment as well. So thank you for that. Let me go back to, and if I'm not hitting my button, you tell me that. Okay, all right. Quality measures. Now I got to tell you something. I'm not an expert on quality measures. There are many people who know this topic inside out. I do know that malnutrition quality measures belong in the future direction of quality measures coming out of the federal government. And our colleagues in the Academy of Nutrition, any dietitians in this room? Are you Academy members? All right. RDs. RDs or nutritionists? RDs. Great people. So you know the Academy. We work hand in glove with them on a daily basis. We just did a webinar on malnutrition on last week, I think it was, and we had 300 some odd people come on. But there's nothing more important right now in the nutrition space and malnutrition space than these quality measures, to get them incorporated into the future of quality measures run by the CMS. And again, that's that infamous quote I gave you before about, they will consider these measures in the future. Okay, again, advocacy is persistence. I'm an Italian American. That was obviously when you heard about the government of Italy. Any Italian Americans in the room? Oh my God, I'm all by myself. How sad. But as an Italian American, you know who I don't like the most? A Columbus Day Italian. Who acts like an Italian, or a St. Patrick's Day Irish person, right? You can't do advocacy in that way. You've got to be at it constantly. You've got to be telling stories. You've got to be building cases. You've got to be doing advocacy. It's a constant process. And this thing is a perfect example, because we've only been in this coalition for 2 years. The Academy and other people have been working on this thing for 4 or more years. And how they measure progress in the bureaucracy in Washington, you blow your mind. You have a meeting, they call that a victory. It's more than that. But I think we're doing better here. We're making more progress. Let's see. Oh, here's something else. 2 other things that we're focusing on. In Washington, it's another one of these great things. What year? We're in 2018, right? So every 10 years, the Department of Health and Human Services produces this process called Healthy People 2020. Now we're into Healthy People 2030. It's supposed to be a framework, a blueprint of things that we should be doing on to keep people healthy when you get to 2030. Well, we're like, okay, older adult malnutrition ought to be recognized as something that we should be addressing to promote healthy aging 2030. But there again, it's a process. You've got to file a comment, you got to go to meetings, you got to sit through all these interminable this and that. But your eye is set on one thing. If it ends up in that thing, it becomes a very important statement. And ACL, now ACL is not the thing you worry about pulling. Okay? ACL stands for the Administration for Community Living, which was an entity that was created a number of years ago, blending 2 disability offices and the Administration on Aging into one unit. And ACL has a nutrition resource center as part of its work. And they are working to improve and expand the study of malnutrition in the Nutrition Resource Center. This next slide, we sort of talked about this a little bit. I'll just touch on it again. We're always looking for new congressional champions. Because if your situation is dependent on legislation, you need to have people in Congress who are there for you. We know the Senate Aging Committee is very involved. The Senate Health, Education, Labor Committee, which is a critical committee for a lot of things we're talking about today, with Senator Bennett on that committee. That's where the Older Americans Act will come up next year. The House Energy and Commerce Committee, which oversees Medicaid, is a very important committee. And, it's all about, again, familiarizing your members of Congress, having them know the work that you're doing. So now, why malnutrition and elder abuse? And this is a new focus, if you will. And I, in my years of working in elder abuse, I'm always astounded by a number of things, not the least of which is how in Washington, there are 7 to 8 different kinds of elder abuse for those of you who are in the field. There's physical, mental, psychological, financial. All the attention's focused on financial, at least in Washington, for this simple reason. It's something you can get your arms around. okay? Like, older victims of financial abuse lose $2.9 billion a year, according to one estimate. You know, that's a real number. You know, people losing their life savings, stories that come to people in Washington, you know. But self-neglect, that's a tougher issue to confront, even though that is now the second fastest growing form of elder abuse in the country. So what we're trying to figure out a way to do is to link issues like malnutrition and elder abuse, okay? And the way it's probably going to get started is by looking at the whole notion of neglect as a growing problem in the elder abuse space, and where does the deprivation of food factor into the prevalence of abuse of neglect. And some work is being done on this topic, and you know, we have the neglect issue, and you know, but food factors into the definitions that go into what constitutes neglect. But you know, as I said a minute ago, it seems as if the focus of the conversations are on either financial exploitation or physical abuse, because physical abuse also makes headlines and does things of that nature. You know, but why is this? I mean, why can't we go broader? Well, you know, it's an after-the-fact situation to some degree. Even though our focus is elder abuse prevention, okay, sometimes things are farther along that may be that are not able to be prevented. And you know, it may be all well and good to be able to find the information out after someone passes, as they did in Japan. But the idea is to address this issue earlier in the process. And again, this goes to some degree to the caregiver education thing we were talking about before. For people who are caring for older adults, they need to have information about nutrition and how to avoid malnutrition. And you know, we're finding that this is one component of the larger elder abuse, elder justice puzzle. And you know, some of you, these are real life stories. I mean, we probably have, some of you have older relatives. Some of you know the story that, you know, we talk about, where, you know, that food that just stacks up in the refrigerator, you know, for any number of reasons. And then ends up being expired food and creating another issue of its own. Or the financial issue, you know, choosing between food and medicine. All real life things that happen, but need to be put in the context of how, in our elder abuse prevention activities, do we bring this malnutrition question forward. And you know, some of it is going to be about the APS folks themselves, when they do their work, to have this in their mind in making questions up in family situations to get looked into. In the ombudsman program, you know, they should be looking at the situation in the long-term care facility that they're investigating. So one of the things that we're going to try to do is try to bring a closer collaboration between the elder justice world and the malnutrition world. And I'm in a good spot, since we run the Elder Justice Coalition, to be able to bring this topic forward. And I feel confident that, you know, we have a new place that we can explore in our efforts to prevent elder abuse. So these are a sampling of the relevant prevention steps that come from the blueprint. And again, you know, some of these are sort of self-evident points. Making checklists available that can evaluate if an older adult may be eligible for nutrition services under the Older Americans Act. You know, those you know, the Older Americans Act is not a means-tested program. Okay? You know, eligibility is 60 and above. There's a degree of assessment that goes into it. There's a degree of capacity that goes into it. And by the way, when we talk about how you advocate and how you build your strategy to raise money, raise the funding levels for nutrition, you talk about things like waiting lists. You know, that waiting list resonates with elected officials. They don't want to be associated with a community that has a waiting list for home-delivered meals. And that's what, you know, that's how sequestration turned around to some degree. Because the minute sequestration hit and the 5% across the board cuts were applied, a number of national associations went out to their members. We have 1,100 members in our NANAS group, and we said, what's this going to mean? What's the impact of this What do you foresee happening? Well, the one that really brought the house down was a program in the Twin Cities of Minnesota. It had been around for 97 years. Was going to have its first waiting list as a result of sequestration. So, you know, making sure that you know where to tell people to go if they need nutrition services. Requires state-based home care standards for training of all home-based caregivers regarding nutrition, food safety, and signs of malnutrition. And these are all connected to one another. You know, good nutrition, you know, prevents malnutrition. Food safety can be a factor in whether a person eats properly or not. Develop and distribute malnutrition-related educational materials for older adults and caregivers. And this can be done through a number of different channels. I know AARP is working on some stuff that gets out to its 38 million members. And other people can do the same thing. These are all basic things that can be distributed in places where older adults go or their caregivers go. Conduct awareness campaigns about malnutrition and elder abuse. You know, anybody here is in the marketing world, the advertising world, come up with a good slogan that could, you know, put this issue even more on the map, we'll take it. You know, it's sometimes it's about the message. You know, hit you. You know, it's got to hit you, and people remember it. And you know, I mean, sometimes they remember things for the wrong reason. You know, you have a great slogan, but then nobody remembers who it is that was selling the product. You know, or sometimes you do a silly thing like the Dodge Ram people did in the Super Bowl, and you know, invoke Martin Luther King in selling a truck. I mean, it was, you know, sometimes you have to be a little cognizant of what you're doing. But we need a message here. We need some new way to look at this issue and raise the awareness on it. So any suggestions that people have, you know, we would welcome them. And then, of course, educating older adults and caregivers on optimal nutrition. That kind of nutrition that would prevent malnutrition from occurring or continuing. And then finally, this is pretty much, this is the second, this might be the last slide. So, how do you get involved? Well, you know, there's nothing that says that anybody in this room couldn't join the Malnutrition Coalition. We welcome organizations, we welcome coalitions, we welcome individuals. And here's the first question that's always asked. And I'll give you the answer before you ask the question. It doesn't cost any money. Okay? We have a very fortunate situation where we've got adequate funding from, you know, a variety of sources to get us for the next couple of years. So people can just join so they can lend their name to it, help us by sharing their stories, help us by giving ideas about, you know, or help us to, you know, put this in more human context, help us to, you know, go to a hospital system and, you know, see who is doing, and like, I'll give a good example. In the state of Illinois, there's a hospital chain up there that has a nutrition care plan as part of its, you know, operations. They estimate it saved them $50 million over the last 2 years by simply having a nutrition care plan as part of their deal. And, you know, we're always looking for, like, who is doing good stuff? You know, who actually does screening? Who does it right? I mean, some of it is about what's the right kind of screening, and there's issues of that nature, but there are things that go on. So one of the reasons why we encourage people to kind of join us is we're trying to build a, you know, a movement that is based on people who have real interest in the subject, who can make contributions to it. So you can go to the website, defeatmalnutrition.today, if you're interested. There's a place you can go to, and you can put your name down, and we'll put you on the list, and you can stay in touch. And then if you have any desire to, you know, have further information on anything that I presented this morning, that is my direct email address, which we'll leave up there. Because again, it's all about, you know, helping to defeat malnutrition at the end of the day. So now we're at that point in the program where we're expecting questions. Since I'm done talking, so anybody with anything, any comments, any thoughts, please.
I just would like to make a couple comments about issues that have been raised in our time together today in regard to a couple possible solutions. We've talked a lot about screenings, and one of the things I think is really important in all of our organizations is to try to make sure that our screening tools do fully capture all the needs that an older adult might be bringing to us. So we were talking a little bit about grandparents taking care of their grandchildren, so that we have tools that we discover that pretty quickly, that this person is also caring for their grandchildren. And so what is that impact in nutrition, and how do we potentially, it may not be that we offer all the services, but how do we get people well integrated into the other services in the community that might meet that need? The other thing, when you were sharing, or when the woman was sharing about her residents and helping them with SNAP applications, it's like, right, like there are only so many hours in the day and we have to sleep in regard to the frontline people are often the people that it's such a struggle to get all the applications done, to say nothing of going to advocate and so on. And so I just want to make a real plug that as much as possible, we're really making creative use of volunteers in the community and also student interns, whether they're social work interns or human service majors and so on, that those can be a tremendous resource to us when we are trying to get those applications filled out, or when we're potentially looking at advocating and so on. And there are some wonderful volunteers out there and people that are really interested in volunteering at that kind of level to really be making that kind of impact.
Thank you for that. And you know, I couldn't agree with you more relative to a couple of things. First of all, the role of volunteers. I mean, the Older Americans Act Nutrition Program wouldn't function, as many programs would not function without volunteers. She's going to know. And you know, they're vital. But it is tapping into all the resources. And again, I encourage people who have not looked at the National Council on Aging's work in benefits access. You know, they have people who, you know, who do that kind of stuff about filling out forms and doing the kind of help on the ground. And they utilize interns, they utilize volunteers for that program as well. And on the screening question, you know, my colleagues in the back, the dietitians there, you know, I don't think we have reached a point where we have the complete screening tool. There have been several been proposed. They're out there. I think they're always looking to make modifications, but eventually, you know, just like, you know, like I had this discussion with some people the other day about something as basic as a definition of sarcopenia. Okay? We're still, you know, we're still not there. I mean, it's got components to it. Yet there's a whole new focus on sarcopenia tied to the malnutrition issue. So, you know, we need to get our arms around an effective screening tool that can be applied as many settings as possible, both, you know, acute care, non-acute care, community settings, and so on. And that's part of what we're trying to do. So your points are all well taken, and let's hope that more people decide to volunteer. Yes, hi.
Okay. I volunteer with seniors that I know. I'm a senior as well. I'm just a little bit healthier than these seniors. And what I'm really concerned about in terms of the screening tool, because I have been with a senior applying for services, and they talk about activities of daily living. My concern about the screening tool is that they don't talk about the amount of energy, time, resources that it takes for a senior who has a lack of transportation, who can't stand to cook, stand up to cook, you know, do those kind of things, that the screening tools that I've been a part of in helping someone informally do not ask those type of questions. And I think they're very specific questions, and I know we're working in a time where things, you know, the bureaucracy is asking you to do one thing in an hour, but I can tell you, because I have the time being a retired person, that it actually took from 11 o'clock to 4:30 to get a person bathed, feeling like they wanted to take a bath, fed, and put back into where they were before. You know, and I had the luxury of doing this for somebody that I care about. And
Right.
I don't know how other people, volunteers or workers or advocates, get to do that.
So you believe that there should be a more accurate
Yes.
screening? So the screening device that you use, a screening tool, comes from who?
Well, this came from a 72-year-old that is applying for assisted living placement.
Okay.
And so, you know, I was helping, taking notes, and I noticed that we talked a lot about ADLs, and I kept thinking, does this person on the other line was trying to do the best they could, did they understand the point? I mean, it was 3 o'clock, and we already had all this preliminary preparation for that interview.
I see, yeah. So
That's
this
my
is for admission into an assisted living facility?
Right.
Yeah, which, you know, is that's a hodgepodge to some degree. It's an industry that is growing dramatically. It's an issue that got called out just 2 weeks ago by that same Government Accountability Office for their failure to deal with abuse that goes on in assisted living. I mean, if assisted living facilities are licensed in this state, I don't know if they are or not, you know, one of the things you can do to go back on the screening side is to go back to the agency that, you know, provides a license, see if, you know, if their screening tool is complicated and is inhibiting people from going, that should be brought to somebody's attention. So I hope you would do that, since you've been through that experience. But thank you for that. Anybody else?
Bob,
Oh,
I actually have a question. Can I ask real quickly?
yeah, please.
As you know, I am with Rocky Mountain PACE, the Program of All-Inclusive Care for the Elderly. And I'm just wondering, is National PACE Association at all involved in this effort? Because I'm thinking of PACE as, you know, they as an intervention, they have the congregate meals and the socialization piece.
Right.
And I'm wondering if there's any involvement at that national level, especially when we're looking at data and within PACE organizations, most PACE organizations have dietitians
Right.
also there. And I'm just wondering if
Good
there's
question. If I had better technological resources, I would open up my phone and see a membership list of the Defeat Malnutrition Today Coalition. I don't believe they are, but I think we could use you as a conduit to help get them in our corner, because you're right, PACE is very important in a number of things. Was there a hand in the back? Did I see
Yeah.
somebody? Yes, okay.
So one of the things, we're from El Paso County, from Colorado Springs, and one of the things I was able to participate in a pilot program with El Paso County Sheriff's Department, and we sat in the intake and release area, and as prisoners or inmates were releasing, we were offering them Medicaid and food assistance applications right there in real time. They were able to process them sometimes same day or within that 7-day period. And we saw the numbers soar. I can't give you exact numbers. CMS pretty much kept track of those numbers. I worked for the servicer for RICO 7, but it was a really good pilot program where we were able to really meet them where the needs were at as an outreach program, and maybe something that other places can look at too. And then one of the things I really appreciate you bringing up, I work for a federally qualified healthcare center in El Paso County in Colorado Springs, and it really concerns me because we have 90,000 patients roughly, and I believe we have one registered dietitian
In the community health center, really?
Yes.
Wow.
And that concerns me, and I'm really going to bring that up to our executive branch and just ask why. I think as an employee, I should get that answer because in looking at these numbers and everything, and I wrote a lot of them down, I believe that's a relevant question. And I hope I'm wrong that we just haven't hired someone else. I'm fairly new to the organization.
Yeah, that's a very good question, and don't let them tell you that they cost too much, because that's not true.
No, I wrote down some numbers.
Yeah. Do our dietitian folks have any thoughts on that subject?
Excuse me, sorry.
Yeah. No, you have a right. That's a very good question to ask, and one that you should get an answer to. And then, maybe you guys swap resources, and if that's the case, that there's people looking for jobs, maybe just a match waiting to happen, and that would be good for both the dietitian and the facility, because federal qualified community health centers is one place where more money is pouring in. There is tremendous support for them on a bipartisan basis in Washington, and we should get the full value at those centers, because their numbers of people coming into them are increasing dramatically. So I'm looking again over here, hoping that somebody on this side's got something they want to ask. Well, maybe not. Anybody else with anything? Yes, sir. I mean, I'm sure that it wouldn't break anybody's heart if we finished before 11, but
I'm actually waiting until everybody asks the nutrition questions. You mentioned in the presentation that the budget that was passed included a clause to prevent sequestration through September 30th,
right.
2019.
Right.
One of our AAAs got a letter, their legislative person sent a letter from President Trump to Congress basically saying you need to enforce sequestration September 2018 and provide essentially the programs that are going to get the cuts. And it was a letter that was issued February 12th, so it's new. And it would have been after the budget passed, so I don't know what that letter has to do with what.
I don't either, because when you lift the caps on spending for both defense and non-defense spending, you are in effect saying there's no need for sequestration, because you are not running up against the caps, which if you do, that causes them, in order to reduce that spending, apply sequestration. I am as comfortable about anything I've said today that sequestration is not coming back. And I don't care, I mean, I say through September 30th, 2019, I don't think it's ever going to come back, because the ramifications that were felt in communities across the country and the heat that elected people took, they don't want to go through that again. And the key point here is, how do you divvy up that new money in a way that it goes to the right programs, that can do the most good? And that's the we're now calling it the 6-week scramble, because it's pretty much 6 weeks to get, your message in about how much this program should get, how much of an increase this one should get. Bring your arguments to the table, your rationales to the table, get your advocacy done on the ground and in Washington. And it's a crazy scene like we haven't seen, like I said, in 10 years. And but I feel confident that we can, on the nutrition side of things, we can make a strong case. And the Older Americans Act, I think, overall can make a better case than it has in a while. So, as we say in Washington, stay tuned. It'll change by tomorrow. So. Going once, going twice. Yes. Well, you get your exercise today, Sherry.
My question is maybe a little far-fetched and looking too far into the future, but what do you think are going to be the leading challenges for maybe my generation or a few generations older than I that are, having these special dietary needs, as far as like diabetics, gluten-free allergies, vegans, things like that? How do you think that moving forward we can push this now, so then maybe it does get addressed in 40 years, that we're going to meet these dietary needs and also personal choices of these people? Because we can't expect someone who's been vegan for 30, 40 years to then all of a sudden get Meals on Wheels and not be able to eat half of it. How do you think this is going to progress?
That is an interesting question. That's a very, very interesting question. Some of it, can be done through modifications in law, to provide greater flexibility in what is served. But I think it's really more about, there are many corporate nutrition providers in the country. Big companies like the Compass and the Batemans and the Valleys and other people who, are the main providers of meals for older adults. And my guess is that some of that rests in them seeing the business case, if you will, seeing the the need to stay current for customer base, for whatever they need to do. So it's going to take some change, obviously, and it's also probably going to be about individual, localized advocacy. I've seen it done in nutrition programs. I've seen organized groups go in and say, this is not the kind of food that we want to have, and but they come in and they show, if you go to this versus that, you'll get more interest from people, more take up from people, and that's the other part of it too. Programs that the older Americans cannot afford not to be flexible because they won't have any new people coming in. So it's a variety of answers. I don't have any one particular one, but I think you nailed a real issue that will have to be addressed and will be addressed over time. Now, the first time you might actually see that is as early as next year when the Older Americans Act comes up for renewal, and is there changes in language that provides greater flexibility for a provider to do things to meet the needs of their community, and in a fiscally responsible manner. And I think those are not incompatible. You could be flexible and still do things in a fiscally appropriate way. So thank you for raising that. Well, you have been wonderful. It has been a pleasure to spend time with you. I hope that some of what we talked about today resonates enough to get you involved a little bit more. We welcome that. And just be grateful for the lovely place that you live. And thanks very much. Okay.